Welcome back to Open Line tonight. We are talking about Nashville General Hospital and where we should go with it in the future. It is a hot button topic right now in the city. The mayor's on one side, a lot of folks on the other side, a lot of disagreement, but something has to change. I think you would agree with that.
Yes, something does have to change, and that is by us opening up and being real with ourselves on how we are going to deal with these health disparities and all the things that we have in front of us. And this is the people's hospital. It's their tax dollars. It's all of the things that the people are opening up to. And our first priority is to take care of the constituents that are here in the city.
I want to introduce you to our guest. If you're just joining us, Metro Councilman Decosta Hastings, who also is part of the committee that is dealing with this issue. You're knee deep in this issue, so you really are a great source for us tonight. We have phone calls. I'm also holding my phone here, not because I'm not paying attention, because we are Facebook Live through NewsChannel5.com. A lot of folks watching there, a lot of folks weighing in, and really a hot button debate here on Facebook too. A couple of things that we can debunk and then we'll dive into as well. Sherry asked, Metro healthcare Metro employees, don't they get free health care, and this is where they would have to go? That is not true.
That's not true. That's not true. Me as an elected official, I have the same health care substance as an employee that works for the public works. Okay. We can. But
it's not free.
No, it's not free. We have we have to pay for it. Yeah. But we do. There is something that we do get by going to our hospital, by the our deductibles and our co-pays are waived if we use our system. Gotcha. Why wouldn't it be? Yeah. Because it saves a lot of money.
And Sherry's point was, under the mayor's plan to eliminate the inpatient care.
Yes.
How would that affect Metro employees?
It would affect us big time because we no longer get that plus system of working within our own system.
Because we're talking about teachers
and dollars, teachers, medical doctors, everybody that eats off of this tree of the metropolitan government wouldn't have that access, and that takes money out of our pockets every month.
Yeah, certainly it does. Another question that's really being debated here, I'm just going to generalize because a lot of people are asking this, but under the mayor's plan, if that inpatient care goes away, if the emergency room goes away, that would feed the surgeries and then people are staying over, what do people do that don't have insurance or are underinsured? Where would they go? What is her plan?
Well, the mayor's plan, she was they came out and they talked about a subsidy to be able to give for-profit hospitals for indigent patients.
So she was saying, we're going to negotiate with the Vanderbilts, the St. Thomas, and say, you accept these people, and then we're going to pay you some negotiated rate on the back end.
But it doesn't make any sense price-wise.
Why?
Because we're only paying for our hospital. We've given $35 million. Do you know that price rate will break us? It will be our, and then you fall into an area to where people will misuse the system. They will say that they're residents of our community, and they're not. We're very close to the borderline of Kentucky or other individuals in other counties. Healthcare is something that is major to every family, and they'll do whatever they can do to get those needs met. I think we need to start home first, and then another problem with being able for that program to add a separate program to take care of that is that the for-profit hospitals only have to take care of the emergency need. After that, you're gone. No post care. Likewise, myself, when I had a appendicitis, post care was a problem for me. And thank God, you know, he was smiling down on a boy like me of being able to find a way to take care of that. I did not have the finances to be able to take care of that. They don't have to do that. Any private entity, the federal government doesn't push to say you have to do that. It's only the emergency need. Even for pregnancies, it's the emergency need. What about the post care? Right. And that's the issue that we will lose, and we'll lose every time. And also the monies, it may start off a little right here, but later it's going to cost a lot. And then if this administration decides, and let's say there is a victory, and there is a part where we close the outpatient source, the next mayor or the next administration or the next council can come behind and decide not to take care deserve any of that because they have the liberty to decide to do that.
Sure.
And we cannot allow that to happen.
Yeah. I do want to jump back to the lines because that's what we do here. We have Jack waiting ever so patiently. Jack, thank you for hanging on. What's your question or comment tonight?
Well, my comment starts out, the representative said about getting real. So the first thing we have to acknowledge is America has the worst healthcare system in the industrialized world. We have the highest costs with the worst outcomes. And if anybody doesn't believe me, check the data. These are facts. Number two, it's classic that the taxpayers have paid for a parking facility that the taxpayers are being charged to use. I've lived in Nashville for a dozen years now, and every mayor that we've had during that time period does not work for the people of Nashville. They work for the real estate developers, they work for the hospitals, meaning the private hospitals. The people of Nashville are a secondary concern. So it is, to me, no surprise that this mayor has no interest in taking care of the best interests of the people, just like the federal government has a similar attitude, and that's why they're trying to slash health care every which way they can. And the goal is that people don't have money. Some of them will just die, and that's fine. If you've ever seen when you have these private organizations that go out and offer free health care, people line up for hours or days to get access to health care. That is how corrupt our society has become.
So, Jack, you're very educated on this, I can tell. What do you propose to happen here? Because something does have to change. Something's got to give. What do you think?
As has already been pointed out, part of the problem here is all the red tape. So the red tape is not a surprise. The red tape is by design. So if, for example, the goal is to make sure all of the patients are funneled to St. Thomas or Vanderbilt or for-profit institutions, which, of course, if we get rid of the local facility, we're going to pay a higher price to get the same services at that private facility, which is going to jack up the cost further. So this is the same stupidity that we've heard from the governor. They tried to cut all of the workers that worked at the state universities. And then they discovered by doing a study that, in fact, we're paying below the market rate for those workers. So this is basically an ideology. It's not intended to be a practical solution. So what we need to do is clear out the red tape, properly fund the facility, and as has been pointed out, have the objective of the facility be to as conveniently and efficiently serve the population it's designed to serve, and leverage the money that we have spent as citizens on the facility and take care of the needs of our fellow citizens, not try to find a way to pad the profits of for-profit institutions. And I'm not a socialist or a communist. I'm an American. And I'm sick and tired of people being sacrificed and dying at the altar of profit. It's not an acceptable value for my community.
Jack, thank you for weighing in. I appreciate hearing your expertise, your education on this, and your thoughts.
Love hearing that.
Yeah, appreciate you chiming in tonight. Let's jump to another caller. We have Shamika on the line. Shamika, thank you for hanging in there. What's your question or comment?
Well, I have a comment, and I just feel like I was actually born at Metro General. Before it was Metro General, it was Harry Hubbard Hospital, and it has a bit of history, and it I consider it to be like a system that's built for low income, and it's predominantly African Americans. Not to say make this a racist issue, because it isn't. It's just I believe that's why it's lack of funding to keep the close-in patient care going. You can find money to support the soccer stadium that you're trying to have to support the state fair, or you can find different other ways to raise money and fund different programs. So why not health care to support our people that are sick? People are dying each day because they don't have insurance. So if we have a facility that helps people with low incomes or no insurance, why should we not keep it?
Shamika, you bring up a great point, and it's a point that a lot of people are also asking on Facebook right now, and it's Gosh, I just lost my train of thought. She brought up a great point. I'm sorry. I will get back to it, Shamika. I really will. I promise you I'll get back. But I do want to jump into some numbers here because I think it's something that Jack brought up and you brought up as well. And I want to make the distinction very clear because I think some people may get lost in the numbers. But when you're saying, under Mayor Berry's plan, she wants to negotiate with the Vanderbilts, the St. Thomas's health cares to have these folks go there, get their care, subsidize it, we'll pay you back. But you're saying it's going to cost a lot more for the same care to go to Vandy than to be done at Nashville General.
Of course.
Because you gave me the numbers, or somebody gave me the numbers before this show, and emergency room costs for indigent patients 45% less than the peer hospitals around here.
Correct.
At Nashville General. 45% less for those services.
Yes.
Sometimes the very same thing.
Yes.
So it's costing taxpayers 45% less than it would if that person were at Vandy right now. Inpatient cost 15 to 50% less than the acute hospital peers.
And not only that, Metro government, we have the sheriff's department, we have the police department, we have the fire department. All of that is a part of our emergency system. For individuals that are hurt and they come there to our facilities, we treat them with no price tag, but we keep up with how much it would cost. It would cost us over another $9-point-something million a year. That's not a part of the total that's being shown right now of what we're saving our taxpayers right now. It's just showing in the part of what the hospital is asking for. The hospital is asking because we already know it's not enough to do what we're asking them to do.
I remembered what I wanted to bring up that Shamika brought up as well, and a lot of people are talking about this on the Facebook Live, is that a lot of people are saying, well, why can't we fund this, but we're talking about a soccer stadium? Why can't we fund this, but we're talking about this light rail system? It all lands on your lap as a Metro Council member, and I would assume that it can't be a this or a that.
It
for
can't,
a viable city.
No, it can't be this or that for a viable city. We have to find a way to appropriate things, but we have to also take care of the things that come first inside of our home. And healthcare is a necessary need that we need to take care of first. If we can't take care of that, we can't take care of other things that are more on the optional side. When I was a kid, I had to buy, my family bought soap. And so I can take a shower or a bath, right? Before anything else, because if you didn't smell right, if you didn't look right, it just didn't fit. So that was a necessary need. A necessary need was toothbrush and toothpaste to brush your teeth. If that didn't work, that means there was another medical bill, which was through the dentist. We have to take care of the needs of our people in this city by doing what we need to do. All of the other things, it was really big when back in the 90s, the Air Jordans, which I know they still wear right now. That was really big. Before I could even talk about anything else, I couldn't do anything. I remember when I was younger in grade school, the Michael Jackson jackets were really big. I couldn't talk about that unless make sure the necessary needs are done. We need to take care of our people, and the people in the city take care of their needs first. After that, we'll talk about everything else.
And you're saying that number is $55 million? That's what we need, that Metro needs to give to the hospital on a yearly basis?
Actually, as of right now. But as the numbers grow,
population-wise,
and people are coming here, especially the ones that may have an issue before they get the insurance at their new job, or the ones that don't necessarily have a job or have health issues or whatever else, we got to take care of those people. And as of right now, they asked for $55 million. That is what we need to grant them.
All right. We're going to come right back with more of your calls and questions. Stay with us on Open Line.